Good morning, everyone. Good morning. It is an honor to welcome all of you to this first ever White House Day of Action on Maternal Health. And I want to thank everyone gathered today, the members of our cabinet, including Secretary Javier Becerra and CMS Administrator Chiquita Brooks-LaSure. And I want to thank the members of Congress, the state and local policymakers, the business leaders, the nonprofit leaders, the medical professionals, the community organizers, the patient advocates, all of you. Thank you for your leadership and your tireless work. And thank you for your partnership and your commitment to take bold action to improve maternal health. This challenge is urgent, and it is important. And it will take all of us. And to put it simply, here's how I feel about this. In the United States of America, in the 21st century, being pregnant and giving birth should not carry such great risk. But the truth is women in our nation, and this is a hard truth, women in our nation are dying. Before, during, and after childbirth, women in our nation are dying at a higher rate than any other developed nation in our world. And when we know that, for some women, the risk is much higher, when we know that, we should do something about it. When we know that today, Black women are 3 times as likely to die from pregnancy-related complications, we should do something about that. When we know that Native American women are more than twice as likely to die from pregnancy-related complications, we've got to do something about that. When women who live in rural America, which has many maternal care deserts, meaning there are no maternal care facilities, and when we know that women in rural America, for that and other reasons, are about 60% more likely to die from pregnancy-related complications, we need to do something about that. And think about it, regardless of income level, regardless of education level, Black women, Native women, women who live in rural areas are more likely to die or be left scared or scarred from an experience that should be safe and should be a joyful one. And we know a primary reason why this is true: systemic inequities. Those differences in how people are treated based on who they are. And they create significant disparities in our healthcare system. And when it comes to pregnancy and childbirth, these systemic inequities can be a matter of life and death. So let us all say, unequivocally, maternal mortality and morbidity is a serious crisis, and one that endangers both public health and economic growth, which means everyone is impacted by it. Because just think about it. Mothers are the backbone of our economy, and their children are the future of our economy. We know that when women do not get the health care they need, families suffer, communities suffer, and our nation suffers. In fact, one estimate suggests that the direct and indirect costs of poor maternal health care could total more than $30 billion. $30 billion in a single year. By the same measure, we know that when we invest in women's health, when we invest in maternal health, economic productivity increases and socioeconomic outcomes improve. It is clear, a healthy economy requires healthy mothers and healthy babies. I will repeat that. A healthy economy requires healthy mothers and healthy babies. And that is why today, on behalf of our administration, I am issuing a nationwide call to action to both the public and the private sector. Through this call to action, federal agencies, businesses, and nonprofits will join together and will work together to solve this crisis. So today, to kick off this effort, our Department of Health and Human Services and Centers for Medicare and Medicaid are launching a new initiative to designate birthing-friendly hospitals. So this is a brand new designation, and the first designation that rates a hospital based on the quality of its maternal health care. In addition, more than 20 companies and nonprofits have pledged to invest more than $20 million in maternal health efforts domestically and more than $150 million globally. They have pledged to invest in remote care monitors for rural communities, to invest in innovative care models for the postpartum period, to invest in education programs for maternal health providers, and so much more. And we will build on these actions in the coming weeks and months. Now, I know we can all agree, we should all agree, that action is long overdue. We have all heard the stories, and some here have lived the stories. Stories of women who experienced pain only to be ignored. Stories of women who experienced postpartum depression only to be dismissed. Stories of women who had to be put on life support or receive a blood transfusion after blood transfusion and could not hold their newborn baby. These stories should compel all of us to take on this crisis, to change the systems and to challenge the status quo that has created this crisis. Now, many of you know this has been a big part of my life's work. When I was Attorney General of California, I established the Bureau of Children's Justice to prioritize the needs of our children and their parents and to mitigate against adverse childhood experiences. The point for me has always been clear. What affects the children of our communities affects all of us. As a United States Senator, I crafted one of the first bills in the history of the United States Senate to target racial disparities in maternal mortality and to take on the challenge of dealing with implicit bias in our healthcare delivery system. Together with Congresswoman Alma Adams, who is here with us today, I introduced the Maternal Care Act. Together with Congresswoman Adams and Congresswoman Lauren Underwood, I also introduced the Black Maternal Health Momnibus Act, a comprehensive bill designed to improve maternal nutrition, to expand affordable housing, and to extend our maternal health workforce to include more doulas and midwives. And for so many women, let's note, doulas are literally a lifeline. And so we must support all these healthcare professionals. And finally, with Congresswoman Yvette Clarke, I introduced the Uterine Fibroid Research and Education Act, legislation that would address many of the biggest issues that affect so many women, the underlying conditions that contribute to maternal mortality, uterine fibroids. And this is especially of concern for Black women, who are more likely to be hospitalized as a result of that condition. So each of these bills forms the basis for the historic investment in our maternal health care included in our Build Back Better Act. Our Build Back Better Act will grow and diversify the perinatal nursing and doula workforce, support the work of the National Center on Birth Defects and Developmental Disabilities. It will promote health equity by taking action from increasing funding for maternal mental health to investing in maternal health research at minority-serving institutions. So here's but an example of what our Build Back Better Act will do. So currently in most state Medicaid programs, they only provide for 60 days of postpartum coverage for women. Our law will require state Medicaid and CHIP programs to provide a full year of coverage after a woman has given birth. Now, what does this mean? It means a full year of coverage for pelvic exams and vaccinations, for postpartum depression, screening, and regular checkups. According to a new report from the Department of Health and Human Services, this would cover 720,000 more people every year. HHS has also put out new guidance today to help states implement the extension. This action will save lives, and it will change lives. Our Build Back Better Act represents the single largest investment to address maternal mortality and morbidity in our nation, ever. The House passed this bill just before Thanksgiving, and the President and I are confident that the Senate will do the same. So as I said from the start, in the United States of America, we must do everything we can to protect and to strengthen both maternal health and reproductive health. This is about the rights of women. This is about the future of our nation. And this will take all of us. And the actions we announce today are just the beginning. In April, here at the White House, I invited women who have experienced personally and deeply the tragedy of maternal mortality. Their stories were different, but they described a common feeling, a terrible feeling, the feeling of not being heard. On this day of action, may the women of our nation know, I hear you, we hear you, and we are here to take action. Thank you again. May God bless you, and may God bless America. Thank you.
Please welcome the Secretary of Health and Human Services, Javier Becerra.
I'd like to begin by thanking the Vice President, Kamala Harris, and also mention to you that for her critical leadership on this and so many issues, we owe her a debt of gratitude. To the many people who have championed this cause for so long, out there when no one was listening, thank you very much for believing that we would finally pay attention. And a special shout out to the members of Congress who have made it their cause through the omnibus legislation to make sure we got this through to the finish line. Every parent in this room knows the joys and challenges of those first months after your child is born. Celebrating that first laugh, soothing that first cry. Every parent deserves those moments. But here in America, far too many never get to experience them. With the best minds in technology, our nation's maternal mortality rate remains higher than most other developed nations in the world. In the US, more than half of pregnancy-related deaths happen after childbirth, during the first postpartum year. That's what happened to one of our own at Health and Human Services, Shalon Irving, an epidemiologist for the Centers for Disease Control and Prevention and a lieutenant commander in the U.S. Public Health Service Commission Corps. Shalon died a few weeks after giving birth to her daughter in 2017. This question will forever haunt me, her mother says. How did my daughter end up a statistic? No parent should ever have to ask that question. And no one should ever have to die after birth in order for us to take action. This is an issue personal for me. My wife, Carolina, is an OBGYN, a maternal fetal medicine specialist who has devoted her career to improving pregnancy care and outcomes. And her work is a testament to the motto, willing is not enough, we must do. At HHS, we're more than willing to take on this issue. We're doing it every single day. In September, we announced nearly $350 million in awards to every state across the nation to support safe pregnancies and healthy babies. We've approved Medicaid waivers to extend postpartum coverage in Illinois, Georgia, Missouri, New Jersey, and Virginia. We know how critical this coverage can be. In fact, our Office of Planning and Evaluation is releasing a new report today that shows exactly that. This study finds that if all states adopt a 12-month postpartum care, approximately 720,000 women in America under Medicaid would have access to full-year postpartum coverage. That, my friends, is a game changer. And in a few moments, CMS Administrator Chiquita Brooks-LaSure will be detailing new actions by the Center for Medicaid and Medicare Services to tackle this issue, including critical guidance for states on implementing postpartum coverage. Of course, this is just the beginning. President Biden and Vice President Harris have made maternal health and equity a priority, especially among Black and Native American mothers. That's why the Build Back Better plan makes significant investments to reduce racial disparities and improve maternal health outcomes. But this is not a challenge that stops at our borders. Even before the COVID-19 pandemic, every year, low and middle income countries, in those middle income countries, more than 25 million women received inadequate or no antenatal care. Just as we invest in improving maternal and child health care here in the U.S., we need to continue the important work of partnering with ministries of health around the world to ensure that all people have access to quality health care. Before Shalon Irving passed away after giving birth to her daughter, she wrote on her Twitter profile, "I see inequity wherever it exists. Call it by name and work to eliminate it." Today, we heed Shalon's call to eliminate inequity in maternal health wherever we see it. Together, we know we can make progress and save lives. So the question then is, are we ready? Thank you.
Please welcome CMS Administrator Chiquita Brooks-LaSure.
Thank you, Vice President Harris, Ambassador Rice, and Secretary Becerra. I am Chiquita Brooks-LaSure, Administrator of the Centers for Medicare and Medicaid Services. As a mother, as someone who has worked to expand access to affordable health care coverage for children and families for more than 2 decades, and as the first Black woman to lead the Centers for Medicare and Medicare Services, the issues of maternal health and health equity are top priorities. It is unacceptable that Black women and American Indian and Alaska Native women are 2 to 3 times more likely to die from pregnancy-related causes than white women, especially when data shows that 2 out of 3 pregnancy-related deaths are preventable. Fortunately, CMS, through Medicaid and our other programs, is uniquely positioned to address some of the root causes, like inequities in coverage and quality of care, that impact maternal health in America. Through our programs, we provide health coverage for more than 144 million people nationwide, including 1 in 5 women of reproductive age through Medicaid, and cover more than 40% of our nation's childbirths. We also have oversight over much of the healthcare delivery system through which pregnant and postpartum women receive care. Today, I am proud to announce 2 important steps that we are taking to improve coverage and outcomes for pregnant people and their families. First, we will be starting the process to establish a birthing-friendly hospital designation that would be posted on our CMS Care Compare website to help families identify hospitals that have implemented evidence-based quality initiatives to keep pregnant and postpartum patients safe. Second, we are providing vital information to states to help them build stronger Medicaid programs, plan for postpartum coverage expansions, and make additional improvements to the pregnancy and postpartum care they provide. Today's guidance outlines an easier pathway established by the American Rescue Plan for states to extend coverage for postpartum people beyond 60 days to a full 12 months. The guidance we have released today will help states implement this option, which will be available beginning April 1st, 2022. But states do not have to wait. Several states have already decided that they can't wait until April to help families. Virginia, Illinois, and New Jersey have all worked with us to secure 12 months of postpartum coverage for their residents this year. We call on additional states to come forward and work with us to extend postpartum coverage as soon as possible. This postpartum period is a very crucial time with more than half of pregnancy-related deaths taking place after birth. That makes maintaining continuous Medicaid or CHIP coverage and ensuring people can access the care they need during the postpartum period a critical issue. This coverage will help people manage conditions like hypertension, diabetes, and preserve access to behavioral health care during this vulnerable time. Furthermore, CMS is working to improve access to and the quality of maternal health care holistically. We're making it easier to enroll and keep Medicaid coverage. We're partnering with states to expand coverage of childbirth supports, such as doula services, which have been shown to improve birth outcomes, like the Vice President mentioned. We are expanding our provider quality measurement programs, and we're working to reward high-quality care. We will work across the federal government with states alongside advocates and stakeholders to improve maternal health, advance health equity, and save lives. Thank you.